Hello and welcome to the Pink Pineapple Podcast, where we peel back femtech and take a bite out of more than just the juicy bits.
I'm Claudia, and I'm Emma's partner in Pineapple for this adventure.
And I'm Emma. Together, we're exploring women's health across the full timeline, from first periods to menopause and everything in between.
Each week, we'll dive into the stories, science, and software shaping the future of women's health, from hormones to hardware, fertility to femtech founders.
Think of us as your slightly nosy best friends who just happen to be doctors with a healthy curiosity for innovation.
We'll be chatting to clinicians, creators, and changemakers, and yes, asking the questions you actually want answered.
So whether you're out for a walk, cooking dinner, or hiding from your to-do list, join us as we get curious, clinical, and occasionally controversial.
This is the Pink Pineapple Podcast,
where women's health meets what's next. Hello, everyone, and welcome to another episode of the Pink Pineapple Podcast. This week, we have Dr. Julie Hammond, and we are actually going to ask Julie to introduce herself this week because she is a very talented lady who wears many hats, and I certainly don't want to forget any of the incredible work that she has been doing. So, Julie, will you take it away and tell our listeners about all the amazing things that you are getting up to at the moment?
Thank you. So thank you for having me, first of all. My name is Julie. I am an NHS and private GP. I'm a mum of 2 boys and also the CEO and founder of Mamar. But in addition to that, I do wear a few other hats. So I am also associate non-exec director for Mental Health Trust. I am also a member of the London Inspire programme, where we work to improve the quality of life and also the education and help to empower Black Londoners as well. And I'm also a public governor for a community trust in Kent.
And this is why
Absolutely
we want you
amazing.
to introduce yourself. Oh, go on, Julie.
So, and I just remembered, and I'm also in the final stages of completing my manuscript for my book on the 4th trimester.
My goodness. Where do you find the time? Really? I mean,
I don't know.
incredible. Claudia, you're going to completely lower the tone now.
As usual, I'm going to lower the tone with my pineapple. But Julie, that's why we wanted you to introduce yourself, because we think that it's actually useful for everybody to understand what a broad range of experience and expertise that you have before we dive into speaking a bit more about Mamar and other things. And I just wanted to bring in my fabulous pineapple of the day. It's just a pineapple with a baby pineapple. That really is all it is today, because we're going to be talking about the postnatal period. So it's a pineapple cradling her own little baby pineapple. And what's most amazing here is that I managed to find a pineapple in winter in Cyprus, because for our last episode, I was completely unable. So I'm very proud of myself.
Yeah, that's a gold star for you, Claudia. I thought there was going to be some kind of root vegetable or something else going on. Yeah, I'm very proud of you this week.
We're back on brand this week.
Fantastic.
So, Julie, we are going to kick off after our bizarre fruit experience of the week. For listeners who haven't come across Mamar before, can you give us a brief overview, please?
Sure. So I am creating a digital health education and community platform, which I've designed to help support parents from preconception all the way through to their child's first 1,000 days of life. So in terms of my parenting journey, getting pregnant, pregnancy journey itself, and also the postnatal period, I found that I often didn't know where to go to access support, even as a doctor, in terms of accessing additional services, accessing a community. So I sort of wanted to create something where it brings all of this into one place, where rather than having to download different apps repeatedly, it's have one app that will carry you through the whole journey.
So it sounds like it was kind of your own personal experience and that gap in the system that's inspired you to create Mamar.
Yes, absolutely. Yeah.
And I know that you're someone, Julie, that is quite public about your own personal experiences. And I know that you've spoken publicly in the past about your own experience of pregnancy loss and also of living with neurodiversity as well. Why do you think that there is still that taboo around the topic of pregnancy loss?
I think mainly because it's unimaginable. No one can really fathom the amount of pain that you have to go through to when you lose your child, and no one wants to even think about how that part of pregnancy. So we almost want to walk around in our little blissful bubble where everything goes right, everything goes perfect. You don't want to think about the things that could possibly go wrong. And I think because of that's why we have the taboo, that's why there's stigma, and that's why women who do go through it and birthing people go through it, they feel shame, and because they're not able to speak publicly about their experiences. It's certainly something that I experienced, that even coming out and telling my story, I was like, is it something I should be mentioning publicly? Is it not something I should keep private? But I just found that, given my experiences and how lonely I felt and isolated in that period of time, I wanted to show people that it's possible to come out the other side and to not just survive, but also continue life on and thrive after losing a baby. And I wanted people to know that they're not alone in there, and there's nothing that they've done wrong and they shouldn't feel ashamed.
So, Julie, do you talk about pregnancy loss as part of Mamar and in the book as well that you have put together?
Yes, so there is a whole chapter in my book that I'm writing that covers having a rainbow baby. So usually people say that once you have your baby after a loss, your rainbow baby, everything's all fine, you should be healed, we can close that chapter on that unfortunate part of life. However, there's still so much complex emotions that I found that I went through, in terms of I was still grieving my loss, but also at the same time, I had this beautiful baby that I prayed and hoped for such a long time, that was there as well. And I just found that I struggled personally just to make that transition, in terms of, okay, yes, I want to be fully present for my baby, because I don't want them to know me as a mother who's experienced loss. And I don't want to not show up for them how I would show up normally. So I just wrote about my experience, and I found that was quite a healing process to do that. And also, again, I'm going to have a whole section in the app where it covers baby loss, and then try and create like a community there where people can speak to each other and support each other on their journey.
Yeah, I think you've raised a really important point, Julie, which is that feeling of loneliness or isolation that women can have with pregnancy loss, particularly if they feel that they can't speak about it openly. I think that people can feel that within the workplace as well. Often people don't disclose, particularly earlier in their pregnancy, that they are pregnant, to employers, and that, I think that can be a really tricky situation to navigate, going through that very emotionally turbulent time and still feeling like you need to show up and do your day job and do it as well as you normally would. And I think that community idea is a really important one. The other thing that I think you've mentioned that is really important is this feeling of self-blame. And certainly in my experience of dealing with women that have had a pregnancy loss, that is a massive part. And I think that there are lots of different reasons for that. I think that us as health professionals really need to acknowledge that and make sure that we're very conscious of the way that we are speaking to women during that pregnancy loss and the terminology that we are using, and also giving women the option to ask questions if they're ready. I feel that, like you said, with that opportunity to write and go through that experience again, there is that healing process. But I think that there's a lot of women who have trauma from pregnancy loss who aren't sure
Absolutely.
how to process that
Yes.
trauma. And with regards to your neurodiversity, I think that can make things even more complex. How do you think that clinicians can support patients, not only through pregnancy loss, but also through a successful pregnancy and that postpartum period?
So I think everyone is different. Some people want more information after a loss. Some people want less information just because of what they experience. I was sort of that person that I wanted all the answers. I wanted to really understand exactly what happened and what I can do to prevent it happening again, essentially. And unfortunately, with my loss, there was no cause. So 50% of stillbirths, there's no cause found. So I fell into that category, which sort of just heightened my anxiety, because I was like, then it can happen again. Like, what happened before? If I can't control those factors or those variables, then it's possible that these things can still be playing a part in my day-to-day life now, and I don't know what they are. So I think it's just really just understanding and having that patience. Obviously, if you've gone through loss in the pregnancy, you're probably going to turn up a lot more to maternity triage for all sorts of different complaints. I know that I certainly did. And it's just to be patient and to, in some ways, in my care, I don't know if this is normal for everyone, but certainly with myself, they gave me some extra appointments just for, I guess, reassurance. So at least I knew that, okay, every 2 weeks there would be a scan. Every other week there might be a CTG monitoring or something would be happening. And it sort of gave me something to look forward to in a way, my pregnancy, in terms of the next stage that was happening. So I think women definitely do need that. And even afterwards, and I would say, particularly after going through a stillbirth or a late pregnancy loss, I went to my postnatal check, which they tell you that you should still go to. And when I turned up, the woman was just like, the doctor there, she was like, why are you here? But I was like, I still gave birth. I still, when you still give birth, you can still tear, you can still have issues with your pelvic floor, you can still have problems with your hypertension, all sorts of issues. But she sort of wasn't aware to check me. I think usually we all focus their attention on postnatal checks on the baby. They would forget that, okay, what about mother's needs? So I found that she was a bit like, oh, baby's not here, why did you come? And then even I felt like, okay, that was a complete waste of my time. It just made me feel so awkward, wasn't helpful in any way, shape or form. Yeah, so just to be mindful, I think that women can still turn up to their postnatal checks without their baby, and then to use it as the time to really just support them and see what support they have access to, and just to take care of them as a mother, just to make sure that all their issues are sorted out. So check, just as you would do for anyone if they came with their baby, still do the same thing for a mother, even if they've had a loss as well. And again, even in terms of the, I guess, access to perinatal services, luckily, I was able to access that in my second pregnancy quite early on, and I was supported. But in my third pregnancy, because of my previous loss, I mentioned this and they said to me, oh yeah, the waiting list is like a year for counselling. And I was like, a year for counselling? I'm already 5 months pregnant. If I was struggling, what on earth would I be doing? Maybe because I didn't necessarily meet the threshold to be under the perinatal mental health team. That's why they just said, okay, go to general counselling. But it just made me just really think about the lack of support. So I think we just need to really start thinking about how to proactively put mechanisms in place to support women.
Yeah, that's dreadful. First of all, your story about going to your postnatal appointment and being met in that kind of way. And I don't think it's unique either, your experience. I have to say that I also, having had 3 pregnancies, found the postnatal part just the part that I disliked the most, that I felt least supported in, that I was kind of left to my own devices very much. I don't know, Emma, whether you feel the same.
I really do. And I'm really sorry, Julie, that you had that experience. I can't even imagine how that must have felt. Yeah, it's really, really disappointing that happened. And I think, as you've alluded to, trying to get specialist input can be difficult. And there are massive waiting lists, particularly around perinatal mental health support. There was a Freedom of Information request that went in 2023 that showed in some areas women are waiting up to 19 months for support. And at that point, it's just too long, isn't it? Life goes by and women struggle. Acute problems can become chronic problems. And as we know that in the media at the moment, there's a lot of emphasis on maternity care with the inquiry. When we're recording, there's been headlines in the last 24 hours about the fact that the person leading the inquiry has actually realised that the problems are bigger than she initially expected. And that postpartum period is incredibly challenging. Obviously, labour and birth, we know, is a very difficult experience for most women, but that postpartum period is very challenging. And I would even argue that first 6 weeks is very difficult. There's a lot of physiological changes. But in my opinion, and I know we're kind of going off on a tangent here, and this is something that I get very ranty about, but in my opinion, the women should be having a second postpartum check around that 3 months point, because I think that a lot of that support starts to dissipate after that 6 weeks. I think with regards to things like paternity leave and sometimes grandparents taking time off, etc. And then women can feel that they're floating around, lost in a system where there's no support through friends and family, and also from a professional point of view, because they're stuck in a waiting list loop. So this is something that I think we really need to look at, and ideally we need a whole system reform on. But that's probably a whole nother episode of the podcast.
I write about this in the book that usually we just see it, okay, 6 week check, tick box. Okay, now you're free to go. Now you're all healed. Everything's fine. But we don't think to check in again. And there's certain other systems in the world where they do have ongoing care, ongoing support as well. And so you did mention about how neurodiversity plays a role in, I guess, that postnatal period, which I didn't quite answer. But I guess in my experience, I found that although not formally diagnosed, but obviously being a GP and being part of the assessment process, I can see certain traits in myself. Definitely would say I have dyslexia if that's been confirmed, but I would say I have traits of ADHD as well. And I found this really came to the forefront when in the postnatal period, when you're not only responsible for organising yourself, but you now need to take on someone else and take on all the additional mental loads. And I would say that what I've seen certainly is that sometimes women can come in late to their postnatal appointments just because getting out of the house with a baby is crazy. For me, I just found that there were times I just give up because I'm like, it's just too much. And those women where they'll turn up to the GP's practice and they'll be like, oh, well, you're late now, I can't see you. And there was one lady who literally broke down crying because she's like, it took me so much to get here. Yes, I know I'm late and I'm sorry about that, but please, can you see me? And I get, again, NHS, the waiting times is excessive and we have very limited amount of time that we can use to spend with our patients. But just to bear that in mind, if a patient's missing an appointment or not turning up, or they might be struggling with certain aspects of caring for their baby, just to think, does neurodiversity play a part in this? Because sometimes this is when it becomes evident in a postnatal period. And I don't think we certainly don't ask any routine questions about this in the postnatal check, but just to see if maybe this could play a role in how well they adjust to motherhood.
Yeah, I agree. I feel like the
Definitely.
system is not really made for the patient or for the woman. It's very much made for the system to be as efficient and optimized as possible. And that's
Yes.
where we end up suffering. When it's funny when you see it from both sides, right? We see it as clinicians, as doctors, we understand, but we also very much understand from the patient viewpoint as well, having been in the postnatal, having been pregnant, having been postnatal and everything. So yeah, I do think the way the system approaches
Exactly.
us women really does need to change significantly. And I also haven't been my bonnet about the postnatal experience. I just think it's absolutely just shockingly dreadful and unsupportive. And I feel very comfortable saying that because I'm now outside of the NHS and outside of the UK. So I don't feel like I'm going to get in trouble for calling it out for what it is. So I'm really glad that it's being looked into and that people are noticing that, yeah, things absolutely significantly need to change.
I think as well, Julie, like you said, I think because often the postnatal check is mum and baby, I think it can feel that a lot of emphasis is placed on baby. Obviously, there's quite a lot for the GP to do in that appointment. There's the full kind of
Exactly.
neonatal check for the baby. They're asking about feeding, wet nappies, if there's breastfeeding, etc. I don't think we're necessarily kind of really sometimes going out of our way and asking mums, how are you doing? I know that there's the Edinburgh Depression Score, which we should all be doing. Often I think that is led by the health visitor. And again, sometimes I
Yes.
feel that can be a bit more of a tick box exercise as opposed to a real discussion. And I think the reason is because that's not a quick discussion. Anyone that's a doctor and that has had a mental health discussion knows that that isn't something that you can do very quickly. And it's something very hard to do when you have a baby there at the same time that you're trying to do a full assessment on yourself. So yeah, so these are I suppose my bugbears with the system as is, and why I think there should be a safety net further down the line to make sure we're not missing anything. But yeah, I think neurodiversity as well can only complicate, as you say, certain aspects of that postpartum journey. And even, I was going to say, even for some women, that's the first time that they might be putting their baby in a car seat. And for anyone that's
Yes.
had to put a baby in the car seat for the first time,
Oh my gosh.
I mean, I kind of after going home, and often I think, you might get support from dad or whoever there. But yeah, that in itself, for
Yeah.
me, can be an
Yeah,
absolute
and
minefield.
the bag with
No,
all the nappies in, you've got to have all the stuff, you've got to remember all these things, you probably still need your pad as well for yourself, and there's
exactly.
so much going on. Why is
Exactly.
this
You need a
not
red
a
book.
digital appointment? Yeah, why is it not a digital appointment? Why is it not a digital appointment for mum, let's say? Baby, okay, we have to examine, we have to
Yeah.
do all these weird and wacky
Yeah.
things with their hips, check all sorts of reflexes. Why is mum's appointment not digital? Very well mental health focused also and holistic. Anyway, let's move on because we will complain about this forever, I think.
Yes.
So it'd be really helpful, Julie, for us to know exactly how Mamar works and how is it different from everything that we've just discussed. What is it about Mamar that is going to help women throughout that postnatal journey?
So I see it all-in-one platform. So it has the aspect of giving you education. You can ask it questions. It's going to have AI, or technology has AI now, so you can ask it direct questions. It gives you some feedback, and it tells you when you can when you should go and seek further medical attention. So it has that aspect, an element of it. It has also the community aspect as well, where it can be broken down into whether or not you want to be part of a community with people similar cultural background or heritage as you. You can also join communities if you're all in a similar stage. You're trying to maybe get your children to school. You want to understand that element of things, or just in terms of, okay, my child, are they developing normally? You just want to maybe share and ask questions. So that's going to be a community element. And I think the most important part for me is the part where you have the service provider marketplace, where you can actually find different services that you may need to access in that postnatal period. Because I was just going on Google and Instagram and hoping that my algorithms would just find me the right person to come across, especially with my son as well. He had a bit of a speech delay, ENT issues, even knowing where to find a speech and language therapist, how to find a private appointment for community pediatrician, because waiting list was about 12 months. I wanted to try and get him seen sooner. I had no idea where I can go to access any of these services. And I just want to bring it all into one platform where it's all there. Anything you need, you can just go into that one platform and access it.
And with the way that the educational piece is done, from your from your website, it says that the sessions are quite short. Is there a reason why you've chosen to do it that way?
Yes. So first of all, new mums in general are short of time, full stop. And then also I was incorporating a neurodiversity element of it in case anyone has any difficulties with attention. And we live in a TikTok generation where people are just used to watching, is it even 60-second videos now? So I wanted to make sure that all those sections, yes, there might be a longer video, it goes into things in detail, but you can just quickly skip to the section that concerns you. Because I found that there were certain times where I would have a question about one particular element and I didn't want to watch a whole 5-minute video just talking about everything. I just wanted to be able to go and get my answer in 20 seconds. And then that's what I really just incorporated into that.
And of all those topics that you cover, which ones seem to resonate the most with people, or have you learned that people are most interested in finding out more about?
Definitely, I'll say it's more so the postnatal element that I found people really interested in. There's lots of things that can happen to your body that people are just unsure about, that you usually go and Google to find. For myself, I think I struggled with breastfeeding, then I struggled to wean off the breast. I didn't know that babies could refuse a bottle. That's not something that anyone tells you when you're breastfeeding, that yes, they might decide they don't want to take a bottle anymore, and then you're stuck with your baby 24/7 until you're able to wean them officially. So these things that people don't really share with you are the questions that people go into Google in the middle of the night and they're trying to get answers for, and it's really difficult to find, but they are included in that app.
And I know that we've kind of touched on the cultural sensitivities when you were saying about people being able to select to be in a community where they have some kind of cultural similarities. Is that a gap that you have seen in the perinatal care space?
Yes, no, absolutely. So when I first had my eldest son, I was away from family. So I lived in an area that was very isolated. There wasn't many people who looked like me at the time in that community. And I just found there were certain nuances that I had in terms of my cultural background, family influences, certain practices that we did that people didn't quite understand. And I just really wanted to be able to talk to other people who understood, who just got it. That I didn't have to explain that, okay, yes, I was struggling with postnatal depression, anxiety, but this is not an expression of that. This is more an expression of my cultural heritage in terms of some of the things that we do and then the practices and the things that we say. And it was just nice to be able to get someone or get a community that just understood it. And in addition to that, I found that for me, when I had my apps that I downloaded, a lot of apps where, if they say they have mums who are pregnant, but the baby is a Caucasian baby, is not a baby that looks like how my child would look. So these are just elements, little things that I just wanted to incorporate into the app, so that people feel like the person or the avatar or the models that are used, they truly represent them. Because I found that, I think, when I eventually found an app that I liked the best was because the baby was a brown baby. And I was like, okay, this is nice to see the baby developing who has the same complexion as my baby will have. It's such a small little thing, but it really does make all the difference, rather than seeing models and things that don't quite look like you and not understanding how things will look like or appear in your skin tone.
And what do you think good cultural sensitivity looks like then within the app? I know you've just said seeing more of a reflection of yourself within the app and a reflection of your own child. Is there anything else, any kind of other key elements that you think that app developers or founders should be considering when they're trying to make a culturally sensitive product?
So I think also think about, obviously, multilingual, make sure it's accessible in different languages, and then to also get people from different communities to use the app, and to, even when information is translated, just to make sure that actually makes sense in the way it's translated and it takes on the certain nuances. Because again, there might be certain words that they don't have in their language, or there might be a way that they describe things that we don't necessarily understand in English. So just make sure that they are people from different backgrounds are involved in the creation process, that will make sure that what you're creating is culturally sensitive and is appropriate for all.
Yeah, I think as well, Julie, like you say, with regards to understanding from a linguistics point of view, I think some people think they can just copy and paste Google Translate into a transcript that they produce, and it just
Yes.
doesn't work like that, does it? There are certain phrases or certain expressions which cultures
Exactly.
will use and others that they're not familiar with. So it's so important,
Exactly.
isn't it, to get that co-design element or a professional translator or representative from
Yes.
that culture to be reviewing that kind of information.
Yes. Exactly. Co-design, that's the word to use.
Yeah. I've got a lot of stories from Flow about this, actually, because we were doing a lot of translating of a lot of health information, as you can imagine. And one of the funniest was that the word period in Portuguese was being changed to a period in time. So imagine how often the word period features in our content as a period tracking app. But every time it said the word period, it would say this point in time. So imagine how ridiculous that would be, and also how much trust you would lose from that audience, because they would be reading this. It just make absolutely no sense. So yeah, I agree with you. We had a lot of people involved in checking and reviewing everything that we created. But yeah, these kinds of things happen.
Yeah, so important.
And Julie, as well, you've mentioned in the introduction about your vast experience as a portfolio GP and some of the amazing things that you've been doing as a non-exec director and in some of the steering groups that you've been involved in. Can you just share a bit more with us about some of the work that you've led in health equity and what is it that really drives you to focus on these areas?
So again, I think from my experiences and just the taboo and stigma around certain conditions, menstrual health, again, something that's quite taboo in terms we don't talk openly about things like period products, feminine hygiene products, all these things you have to hide it. You don't really show when you're on your period. It's seen as something that's shameful. So I noticed that, again, particularly with my struggles with mental health, that's something that, again, there's so much stigma around and so much misconception in terms of if you're struggling with mental health, it's something that's going to be lifelong. Oh, you shouldn't take medications. Maybe it's okay to have a bit of therapy because you're just talking to someone, but definitely if you need that next step of intervention, it's frowned upon. So I wanted to sort of break the stigma and sort of start talking about these things openly. And again, we know about all the different conditions that can disproportionately affect people from ethnic minority backgrounds. And I wanted to just educate people so they feel empowered that they first of all, they're aware of these conditions so they can go to their GP and be like, I am concerned about this particular problem. And also they're aware that they can also go to the GP and just ask, you know what, I would just like to have a health check. I just want to know what my blood pressure is. I want to know what my cholesterol levels are. There's nothing wrong with being able to go to your GP and ask for that. And a lot of people from my communities, they don't necessarily know that that's something that they're able to do. They usually think they should only be able to get blood tests if something's wrong, but you don't always need to do that. You can just, if you really just want to find out what your levels are, you can actually go and check as many other people from different backgrounds do. So I wanted to educate people on that. One of my other roles I forgot to mention earlier is that I also write a health column for the Voice newspaper, which again is aimed at a Black audience. And I talk about all these different health conditions and all the taboo conditions, prostate cancer, mental health, all sorts of things, pregnancy loss. These are the topics that I've covered in my articles this year. So I really just wanted to cover that. And now I've forgotten the main question. I feel like I sort of went off on a tangent. What was the question again? Sorry.
So kind of about your work in health equity and about what's inspired you. So I think you answered that question quite well, Julie.
You answered it.
And then also I was part of the founding team as well for the Black Health and Equality Summit. Sort of came up with the idea and then I was just supported by an incredible Caribbean and African Health Network who just took it on and just gave it new wings and made it to life. So I sort of just wanted a place where everyone's doing such incredible work in silos. I wanted us to all come together under one roof where we could share our ideas, share the good practices, good things that we learned, also share struggles as well and help to support each other in our journey. And then it's just blossomed. And I think last year we had over 700 people in attendance. So it's just growing year on year.
Yeah, that's brilliant,
Incredible.
Julie. Yeah, it's absolutely brilliant. I wanted to ask you a question just as we wrap up now. If there was one misconception about motherhood that you wish we could unlearn in 2026, so just banish, get rid of this misconception, what would it be?
So many different elements, but I think The one thing is that I think, well, two things. I'll be cheeky and do two things. But
All
the
right,
first thing is
fine.
that just because something I'll say just because something is common is not normal. I know we're hearing this phrase a lot recently, but I have friends who also are doctors who may have given birth, might have had a third degree or so tear, and then they'll be like, oh yeah, I just have to wear an incontinence pad now. It's just something I've accepted. And I'm like, no, just because it is common and it can happen, this is not how you have to live your life. There are interventions, there are treatments that are available for you. Obviously, if you want to have more children, certain interventions you might need to wait, but there is hope on the horizon, and you shouldn't just say, okay, this is my life and give up. So that's one of the things I want to really just break down and to say, if there's something wrong, if you're struggling to pass urine, having accidents, not able to control your bladder, both on the bladder and also the bowels as well, or you're just finding sex uncomfortable, you should still be able to enjoy sex after giving birth. Just because you have children doesn't mean your sex life is out the window. Seek help. There's help available out there, and it's nothing to be ashamed of. When you go and mention it to us, I've certainly heard all sorts of stories. Nothing you're going to say is going to surprise me. So please do feel free to go and see your doctor or GP. And then I guess the second part is that if you are struggling, that you have to struggle alone, again, seek help. And don't be afraid that if you do need to perhaps get more support, so instead of just having therapy alone, if you do need medications, it's okay to take the medications. Again, you don't have to be on it long term. You can take the lowest dose possible, and then we can review things again in 6 months to see if you still need to continue it on. Again, it's not a sign that you're failing, that you are crazy, or that there's something wrong with you. Motherhood is hard, and we don't have the community that we used to have back in the day. I guess in our parents' generation, we're trying to do this all independently, and that's why we're really struggling. So please do seek help. There is help available for you. You don't have to wake up every single day struggling or feeling depressed or low or tearful. Things can get better.
Yeah, I totally agree. And if you're not being listened to, because I can imagine some people hearing you say this and say, yes, but I'm going and no one's listening. No one's actually doing anything about it. You need to find someone that will listen to you. Unfortunately, not everybody will. Not everybody's had all the right training. Not everybody understands. So you have to keep pushing until you find somebody that will listen to you. Yeah.
Exactly. And when I look back at my practice as well, I can definitely say that there are certain areas that definitely, especially when I was more junior and we're not really given a lot of training on how to deal with mothers who've come in with loss and how to approach natal check. And it's over time that I've definitely said I've gotten better at it. I listen to patients a lot more. I hear them. I act on what they're saying. So it is a process. And just because one doctor's not listening to you, please, as you mentioned, go and find someone else who will.
Yeah, I think this is probably quite a good point as well for us to just to mention that obviously we've talked about some quite emotive topics today.
Yes.
And I think that, Claude, you've just raised a point that, often people can feel that they're not being listened to. There are some amazing third sector organisations out there. So for some people, if you're listening to this and you have had a pregnancy loss, there is the Miscarriage Association. If you've suffered from birth trauma, there's the Birth Trauma Association. And with regards to things like the third and fourth degree tears that Julie was just mentioning, there is MASIC as well. So there are lots of great charities out there who can help you as well advocate for yourself and have got like a wealth of resources as well. So I think that we're so fortunate that these people exist, people like you, Julie, who are championing and taking on these problems and making things better for people. So
also want to mention Tommy's as well as another charity that's quite good, and also they have resources particularly for Black and brown women as well.
Of course, yeah, Tommy's are amazing. How can we forget about Tommy's? They're fantastic. So Julie, there will be, I'm sure, lots of people wanting to find out more about you after this. So where can they find out more about you, and also where can they learn more about Mamar?
Okay, so in terms of finding out more about me, you can follow me on Instagram, Dr Julie_GP. I'm also Dr Julie Hammond on LinkedIn as well. And my website for Mamar is www.mamarhealth.com. You can find me there as well.
Thank you so much, Julie. It's been such a really nice conversation with you this morning. I've really enjoyed it.
Thank you for having me. Thank you so much for having me and letting me speak openly about all of these topics and just creating that space. Thank you so much for doing the work that you're both doing.
Thank you,
It's been a pleasure.
Thank you so much. Bye.
Bye.
See you.
Bye.
Thanks for being here. We love having you with us on this journey through women's health and innovation.
Follow us on Instagram at the Pink Pineapple Podcast for clips, conversations, and the latest in women's health and femtech.
We'll see you next week. Same pineapple, new topic. Everything we talk about on the Pink Pineapple Podcast is here to inform and inspire, but it's not a substitute for professional medical advice. If you're worried about your health, please reach out to your GP or healthcare provider.